looking to suspend the rules so that we can immediately take up and hopefully pass what we call the premium assistant bill, House File 1. There have been a group of legislators, Senate and House, bipartisan group meeting since before the election on this issue. I think everybody understands the urgency of this. The governor had a press conference on Tuesday and expressed his desire to see a bill on his desk quickly. The speaker and the majority leader, I think, took him up on his offer, and I think everybody wants to signal that we're working on this, signal to the people of Minnesota that we're working on this as quickly as we can. I'm hoping that we'll do it in a bipartisan fashion. Members, please join me and vote to suspend our rules so that we can immediately take up House File 1. And Mr. Speaker, I'd like to get a roll call, please.
Roll call has been requested. Seeing 15 hands, there will be a roll call. Discussion on the motion. The member from Blue Earth, Representative Considine.
Thank you, Mr. Speaker. I haven't seen this before. Are we taking up right where we left off last year? This is the a new healthcare bill? Am I missing the? Oh, okay. Will Representative Hoppe yield for a question?
He'd be happy to yield. Representative Considine.
Okay. Is this the bill that we've been talking about all along?
Representative Hoppe.
Thank you, Mr. Speaker, and Representative Considine. Sort of. This is a bill, we've been talking about a lot of these ideas. The Senate is going to introduce Senate File 1, which is not identical to this, but the idea is that we pass this today, it goes to conference, and we figure out a bill. I think everybody agrees that we need some relief and that we need not just premium relief, but that we need some reform. To what degree or another, I think differs. We need to come up with a bill that can pass this body, hopefully again with broad bipartisan support, can pass the Senate, and that our governor will sign. So we think this is a good starting place. Will this be exactly what lands on the governor's desk? Probably not. But I'm hoping that we can signal to people in Minnesota today that we're ready to get going and work on this and take it to conference.
The member from Blue Earth, Representative Considine.
No, thank you, Mr. Hoppe.
Any further discussion on the motion to suspend? The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Well, here we go again. Members, here we go again. Not just that we're starting a new session, that's wonderful. Here we are in this wonderful building again. But here we go again, taking complex bills and asking members to vote on them with barely a chance to even read what they say. Members, this bill contains a lot of extremely complex policy impacting our health insurance individual market. Complex policy, some of it might be good, some of it might further destabilize our individual market. So, what we're doing today is what Representative Hoppe is moving to do is skip the committee process. Skip the process where members of the public get to read the bill, get to come in and testify about the bill, get to know about the bill. This is the process where members of the public would get to contact you, their representatives, to tell you what they think about the bill. So all the people you represent, all the farmers who buy in the individual market, whose premiums have gone up really high, all the small business owners whose premiums have gone up, they are counting on us to first of all, do no harm, to do no harm. Now, most of the things we're talking about in this bill, yes, there's some premium relief, a very complex, brand new policy that nobody's seen before today, or many of us have not seen before today, a few hours ago. Complex way to do this that has not been heard in any committee. But most of this is reforms to the individual insurance market that would not go into effect until 2018. So there is time to take this through a committee process. It can be a quick process, but we have to let people come in and tell us how this will affect them. Members, this is really a risky and reckless bill. To suspend the rules, to pass this to a conference committee, and have it be worked out in conference committee? Here we go again. This is Groundhog Day, members, because this is what happened at the end of last session. Remember, at the end of last session, and mind you, the session before, bills got dropped on members' desks without any committee hearings, without opportunities to really read what you're voting on. And there we were, and a lot of mistakes were made. And I would think that the Republican majority would be very gun-shy now and would not be willing to go through a rushed process, cutting out the public on something as important as people's health insurance coverage. All the people that you ran saying how much you cared about their health insurance, you are now putting it all at risk with a risky bill that has not been properly vetted. So members, if you care about, and Mr. Speaker, is there already a roll call vote on this motion?
There is a roll call.
There is, thank you.
Representative Liebling.
So members, if you care about, and I think everybody here does care, everybody here wants Minnesotans to have health care coverage, to be able to access health care. If you do, and I think you do, I urge you to vote no on this reckless, risky motion, and let's send this bill through the proper process where it needs to go. Thank you, Mr. Speaker.
The member from Ramsey, Representative Murphy E.
Thank you, Mr. Speaker and members. I got a copy of this legislation this morning. I heard that the Republican members were working on it, I think on Tuesday night, so I was glad to get a copy of it this morning so I could take a look at it. I've just got a couple of questions, if that's okay, if Representative Dean would yield.
He will yield. Representative Murphy.
Thank you, Mr. Speaker. And Representative Dean, you and I talked a little bit before this, and Connor McNutt, who is my LA, is out sick right now, so I'm trying to keep up with my own calendar. So I checked my phone here this morning, and it looks like our committee, the Health and Human Services Finance Committee, is going to meet 3 times next week, next Tuesday, next Wednesday, and next Thursday. Is that accurate, Representative Dean?
The member from Washington, Representative Dean.
Mr. Speaker, Representative, that's correct.
Representative Murphy.
Thank you, Mr. Speaker, and thank you, Representative Dean. And Mr. Speaker, I'm wondering if Representative Hoppe would be willing to yield for a question.
He will yield. Representative Murphy.
Thank you, Mr. Speaker. And Representative Hoppe, I haven't been able to go through this with a fine-tooth comb. And of course, there has been a lot of discussion about relief for people in the individual market, a lot of work done by legislators with the administration. One of the things the administration had really worked hard on was to make sure that we could do this swiftly, the relief, which we need to do, swiftly by using the health plans to administer the relief. Is it accurate that in this proposal that instead of going through the health plans, this proposal suggests that we should use MMB to administer the relief?
Representative Hoppe.
Thank you, Mr. Speaker, and Representative Murphy. Yes, that is accurate. That's the plan that we put forward.
Representative Murphy.
Thank you, Mr. Speaker. And if Representative Hoppe would yield just for one more question.
He will yield. Representative Murphy.
Thank you, Mr. Speaker. And Representative Hoppe, has there been work done with the administration to understand if they can implement this policy? As I understood it, this was the governor's first preference, but the administration said that they would not be able to administer this. So my question for you is, in the couple of days that you've worked on this proposal, have you reached an agreement with the administration about whether or not they can actually implement this bill?
Representative Hoppe.
Thank you, Mr. Speaker and Representative Murphy. No, not specifically, but I have confidence in them. Just so members know, if we're talking about the governor's plan, and I do applaud the governor's sense of urgency, if we send the money to the insurance companies, we're looking at probably 8 to 12 weeks before they can implement it. I have confidence that our state revenue department, MMB, whatever we're looking at, can do it just as well as an insurance company can. And it's going to take some time to get this set up, whoever we have do it. Whether we have individual checks go to the people that are impacted or we have rebates taken off of, as the governor's plan was, it's going to take some time.
Representative Murphy.
Thank you, Mr. Speaker, and thank you, Representative Hoppe. I appreciate that. I think Minnesotans have been clear with us that they expect us to act on this issue. But I also believe that Minnesotans expect us to be a couple of things. They expect us to be swift, but they also expect us to be competent. And under GOP leadership, we have seen now a number of examples where the swiftness of action, especially at the end of the session, has yielded mistakes. And that meant that Minnesotans didn't get tax relief at the end of last session or a bonding bill. So from my perspective, we should be both swift and competent. And if Representative Dean is holding 3 hearings next week, Tuesday, Wednesday, and Thursday, there is no reason why we couldn't hear this legislation properly in committees to make sure that we have ironed out not only mistakes that could be embedded in here, and I'm afraid, with just getting the bill this morning, I haven't been able to take a good look at it, but also to make sure that what we're passing can be implemented by the administration. And if we take the shortcut, which we're proposing to do today, we could miss that and actually delay the proper implementation of the relief that we all want together. And for that reason, I hope that we do not suspend the rules today and that we let this bill be heard in committee so we can make sure we understand what we're doing and quickly, swiftly, and competently get relief to the people of Minnesota. Thank you.
The Minority Leader, Representative Hortman. The member from Ramsey, Representative Lesh.
Thank you, Mr. Speaker. Would Representative Hoppe yield to a question?
He will yield. Representative Lesh.
Thank you, Mr. Speaker. Representative Hoppe, I don't really know what's in this bill yet because it was just introduced, but I'm wondering if you can tell me. I'm guessing that there are probably several provisions in here that members on this side would object to more than others. Would you be willing just to give a quick breakdown of what you anticipate those more controversial issues would be, so I know what to look for?
Representative Hoppe.
Thank you, Mr. Speaker and Representative Lesh. We can talk about a lot of the reforms. One of the things that's in here is surprise billing, which is originally a Democrat bill. I'm not married to any of these things. I think the governor would agree. I think everybody agrees we're going to need to look at some reforms. It's a matter of how much reform is going to be in this bill, how much reform is going to be in House File 5. We're going to have reform there. We're going to be talking about health care and health insurance and reform a lot all session. And just so members understand, a green vote today to suspend the rules does not mean we are passing this bill. It means we're sending this bill to a conference committee. People are going to be talking about this bill the next week. The Senate is going to have hearings. The conference committee, we could do it in the Commerce Committee. Representative Dean can do it in the HHS Finance Committee. We've been talking about this bill since we found out that this was going to be a huge issue in October. We talked about it up to the election. We've talked about it since the election. We've talked about it. The Senate has talked about it. Our constituents have talked about it. Yes, there are reforms in here, and Representative Lesh, you're right. There are some things that your members are probably not going to like as much as some others. There are some things that our members are not going to like. This is not going to be a bill that everybody loves or maybe even likes at the end of the day, but you're right. There are things in here that people are going to like more and like less. Well,
Representative Lesh.
Thank you, Mr. Speaker, and thank you for the answer, Representative Hoppe, but forgive me if your assurance that this is going to be worked out in conference committee doesn't make me feel better. We've all seen some crazy stuff out of conference committee that comes back to this floor, both sides, no matter who's in control. Some eye-popping stuff that suddenly had to be voted on immediately because session was ending or there was a certain deadline. So I don't like the sound of that, but because of the fact that this is the first thing we're looking at this session on the first day of actually doing any work, I would think, as was suggested by Representative Murphy and Representative Liebling and others, that we would have some time to do this. I don't want to let them work out the details in conference and come back to us. Mr. Speaker, would Representative Hoppe yield to another question?
He will yield. Representative Lesh.
Thank you, Mr. Speaker. Representative Hoppe, does this bill create any data sets of any individuals that would require, under the rules, that this bill go to civil law?
Representative Hoppe.
Mr. Speaker, Representative Lesh, I don't think so. But if there are data sets and that's something that you're concerned about, as you know, last session I served on civil law. I enjoyed the experience. If that's something that you want to talk to Representative Scott about, we're more than willing to talk about that. If it's something that gives people discomfort, whether it's you or somebody in the Senate or somebody in the administration, let's work on it. Again, we're not We're not passing this bill today. There's still going to be work done. And Representative Lasha and Representative Liebling, I have an idea. Vote yes on the bill, and we'll put you on the conference committee. Then we can all work on this together. It'll be fun. Trust me.
Oh yeah, I couldn't wait for that. A healthcare conference committee, sign me up. Well, like I said, we've done stuff like this before, but I just think this is a bad way to do legislation. You don't have my vote on this one, Representative Hoppe, but I wish you all the best of luck on it.
Any further discussion on the bill, or excuse me, on the motion? The member from Hennepin, Representative Loeffler.
Well, thank you, Mr. Speaker, and representatives. I just think we all know there is an issue in the individual market, and I think people of goodwill on both sides have been talking about options and approaches, and the governor threw out a proposal that had a lot of discussion and a number of meetings that some of us who work more in this area went to. But we were very clear about short-term relief for the 125,000 people in the individual market facing really high increases versus long-term reforms. And in all of our discussions, we separated that, and we said for the long-term reforms, we needed to see real analysis of what the impacts would be on small businesses, on their employees and the employee coverage that they get, and on the impact on the overall market. For those of you who are at One Minnesota yesterday, we heard from bipartisan national experts say go slow given what's going on in Washington. This isn't the time to do major reforms till we get a better, clearer idea. And so, Representative Hoppe, if you would share with us, have you seen any analysis of the reforms that you have in Article 2? Because we have not seen that, of really what it would really mean to the insurance market in Minnesota for those who get their insurance through small employers, through big employers who buy in a market that's really undergoing a lot of stress.
He will yield. Representative Hoppe.
Thank you, Mr. Speaker and Representative Loeffler. You know, I don't have any distinct analysis of it. What we're trying to do with this bill, and the reason we wanted to do it so quickly, we're going to go hopefully really fast today, and then the process is going to slow down. By going so fast today, all we're really wanting to do is send a signal, and some of those reforms in there are sending a signal not just to our current health insurers, but to providers and to people that might decide to provide health insurance in the future, and to Minnesotans. We're not going to have a great impact on, you know, the rates are more or less already baked for 2017. We're hoping to give people a little bit of premium relief. What we're hoping to do for 2018 with some of these reforms, and again, this is not our final product. This is going to have to be a bill that we can all, or at least most of us agree to, most of the Senate agrees to, and that the governor will sign. But we're doing this to try to give a little bit of help to the people of Minnesota and to save, you know, we're not doing it for this year, we're doing it to really try to save the individual insurance market, health insurance market for 2018 and beyond. And you were right, you said something earlier, a lot of people of goodwill on both houses, in both body, or Democrats and Republicans, Senate and House, have worked on this and will continue to work on it. And they will be people of goodwill. All of us want the right thing for the people of Minnesota, for our constituents, for our consumers. We're just differing a little bit on how we get there and exactly what form it's going to take. Thank you for the question.
Representative Loeffler.
Thank you, Representative Hoppe. And I think you have sent a signal by introducing a bill, but developing, refining, and preparing a set of solutions is best done in committee, and I would really encourage people to vote no.
Any further discussion? The Minority Leader, Representative Hortman.
Thank you, Mr. Speaker and members. I think you saw on the federal tax conformity bill that the DFL House Caucus is here ready to work in partnership with the Republican majority to get things done for the people of Minnesota to improve their lives. And we are certainly ready to move quickly to get relief on premiums to Minnesotans. We have some very clear language that's been out since December 2nd that all of the leaders agreed was appropriate relief for Minnesota families. But members, today I would encourage you to vote against a suspension of the rules, because what we have before us in House File 1 is not that language that all the leaders agreed to on December 2nd that was known and clear and quantifiable and would provide immediate relief to Minnesota families. We're ready to work, and we showed you that on the tax bill. But members, please vote against the suspension of the rules. House File 1 is not ready for prime time.
The member from Hennepin, Representative Pepin.
Thank you, Mr. Speaker and members. I would encourage us to suspend the rules so that we can vote on this urgency. I have to say I'm a little surprised from some of the comments on the other side. You know, as you know, several years ago we voted on this and there wasn't one vote on our side of the aisle for creating this system in Minnesota because we had one of the best healthcare systems in the world. But nonetheless, it passed, it became law in Minnesota, and the result was exactly what we predicted. And I encourage you all to go back and listen to some of the speeches that happened when that bill passed and some of the questions and the concerns that we had, because a lot of this stuff was really, really predictable. And it happened just as the experts had predicted it would happen. And so, you know, when you talk about, somebody mentioned a real analysis. We need to do a real analysis to make sure we fix this. And I agree, we do need to do a real analysis. And I wish that would have happened years ago when this passed. But the fact of the matter is, our constituents are hurting. The average increase was something like 67% this last year. And that works out to, in some cases, $30,000, $40,000, $50,000. And I know you've all had constituents that have talked about it. They don't want to play games. They want this to be fixed. And so this is an initial start to the process. I believe we owe that to them. We owe the citizens of Minnesota. We owe them that we need to fix this problem because we created the problem. So I suggest we get going on this today. I'm also a little disappointed because I thought we had an agreement that we were going to suspend the rules. You know, members, we have a choice. We can get going today and start working on it, or we can continue to play political games. I would suggest we take the high road and go working on it right away today. So members, I would ask for a vote to suspend the rules so we can take up this urgency and we can help the many Minnesotans who have been hurt by the actions of the Minnesota legislature. Thank you.
The member from Carver, Representative Hoppe.
Thank you, Mr. Speaker. And thank you to everybody that spoke today. Thank you to everybody who provided ammunition to the people that did speak. We've had a lot of debate about this. We're going to have a lot more debate. If you don't like health insurance or health care talk, get ready because we're going to have months of it. And I think it's important. It's important to all of us. It's important to our constituents. And I think it's right that we're going to have that. And I think two things didn't get mentioned that we need to mention and we need to keep in the back of our minds. Maybe somebody did mention it. We don't know what's going to happen in Washington. What we can tell you almost for sure is, well, for sure, the individual health insurance market is going to be different in 2018. We're going to try to put our stamp on it. Democrats will have input, Republicans will have input, senators, House members, we're all going to have input. We're going to listen to outside parties. We're going to listen to providers. We're going to listen to insurers. We're going to listen to average constituents, average citizens, and get their input on it. So I mentioned the federal thing. The other thing we didn't talk about, one of the reasons we want reform in this bill, and again, I think the governor, I think everybody agrees, you know, we need some reform. It's just a matter on exactly what we're going to agree on. One of the things that reform is going to do, it doesn't do you any good to have health insurance if you can't have access to health care. So that's going to be part of the reforms. We need to get these, you know, as I said, 2017 is already in the books. The open enrollment is done. We want to try to help a little with premium relief, but we're looking at the bill that we're going to come out with. We need to help access and other things in 2018 so that our citizens have the ability to go to, you know, the provider. Nothing's ever going to be perfect. We should have our networks be more robust and more ability for people to go see who they want. When we give people premium relief, whether we wind up doing it as the governor wanted to do it through the insurance companies, you know, if it's a simpler plan or we do it through the Department of Revenue, I think our Department of Revenue is competent, and I think whether it's the insurance companies or the department, it's going to take some time to get this done. Whatever we do, whether we, and I hope members do vote green on this today and agree to suspend the rules, whether we do or not, we're going to pass a bill relatively soon in conjunction with the Senate, and when we do that, there is going to be premium relief in there. We want to do that as quickly as we can for the people of the state of Minnesota. With that, I've probably spoken enough. Members, I'd appreciate a green vote. Let's suspend the rules and then send this bill on to a conference committee. Thank you for your time and your support.
Seeing no further discussion, the clerk will take the roll on the motion to suspend the rules. Clerk will close the roll. There being 75 ayes and 55 nays, the motion does not prevail. There is another motion at the desk. The clerk will report the motion.
Pursuant to Article 4, Section 19 of the Constitution of the State of Minnesota, Liebling moves that the rule therein be suspended and an urgency be declared, and that the rules of the House be so far suspended so that House File Number 67 be given its second and third readings and be placed upon its final passage.
The member from Olmsted, Representative Liebling, to introduce your motion.
Thank you, Mr. Speaker. Well, this is my motion to suspend the rules to take up the bill that we all should know what's in it, and this is the governor's rebate plan, which is to provide a 25% rebate to people who are buying their insurance in the individual market, but who have not taken advantage or are not eligible to take advantage of the premium rebates through MNsure. This is not a perfect bill. I think everyone acknowledges that, including the governor and his staff, because indeed, members, it's kind of a blunt instrument. But the governor put this bill together. This has been talked about since last October. When the speaker was, before the election, when the speaker said how urgent it was, and indeed it is urgent, to get help to people who are indeed having trouble paying for these very high premium increases. So this bill, although it isn't perfect, would bring immediate relief, and it would buy us time to deal with these other kinds of issues that Representative Hoppe just spoke about, which are really about 2018. So there is no reason that these two things have to be done at the same time in the same bill. The bill that I'm speaking about today, as I said, it's kind of quick and dirty. It doesn't have in it anything that calibrates the rebates by the income of the family. And it does go through the insurance companies, which have been spoken to and have said that they can do this. So this is something that, although it's not ideal, we know that it can be implemented. That is the important thing about it. It's been talked about since October. This is the bill the governor had wanted to pass. This is a bill that the speaker at one time agreed with. And yes, it's not the absolute best thing we could have done had we had more lead time. But this is urgent because open enrollment is still going. Although we've missed a couple of deadlines already, it would have been really great to have this before open enrollment started so that Minnesotans would have known what they would be having to pay for their insurance. It would still help these many families, many of our constituents who we're hearing from who are struggling with the high premium cost. This is immediate relief. And so, members, I would ask you to give full consideration for voting to suspend the rules so that we can get this relief. I know we've just talked about it. It's very important to get this urgently to Minnesotans. We should all be fully informed. The public has seen this. It's been out for quite a long time. And so I would ask you to vote to suspend the rules. Thank you.
The member from Sherburne, Representative Zerwas.
Well, members, here we go again. We have the Democrats that voted against our motion for urgency to provide relief and reform. And they said no. I'm old enough to remember a few years back when we all saw the writing on the wall as MNsure failed, and failed Minnesotans and hurt Minnesotans, as all of us in this chamber heard from our neighbors, our family, and our friends that MNsure was crushing them. It was destroying their family budget. It was destroying individual business makers, and it was running them out of business. I remember, members, when we were still in the minority, And we begged for amendment after amendment to help us fix this failed program years ago. And we got nothing. And Minnesota got zilch. I remember the following year, after MNsure was in place, hurting Minnesota families, and we had bill after bill and amendment after amendment, and the House Democrats wouldn't hold a hearing. And in the HHS supplemental budget, when we tried to address these issues, what did we hear? Oh yes, we heard that all of our ideas, all of our fixes were not germane. And we were told to sit down and that our fixes weren't needed. Well, here we are, members. MNsure has destroyed the middle class of Minnesota. It has harmed Minnesotans. And if you want to giggle about it, come on up to Sherburne County and visit with some of my constituents. Come on up. You pick a day. I'll take you. This is not a laughing matter. And what your bill does not do, Representative Liebling, it does nothing for the constituent in my district that is in the middle of life-saving chemotherapy cancer treatment at the Mayo Clinic, but got their insurance cut off. There is no additional continuity of care in your proposal, like you just voted against in ours. Your proposal will provide 25% subsidy reductions to millionaires and billionaires. Wow. Welfare for the rich. That's a new one from you guys. So I guess I'd be a little gun shy after you just said no to relief and reform, that you now turn out and try to leave Minnesotans out in the cold with no hope of continuing their care, with no urgency to reform the system you helped destroy. This is a sad day for Minnesotans that look to us for help, and all they see is Democrats obstructing a path forward.
The member from Carver, Representative Hoppe, to the motion.
Thank you, Mr. Speaker. And Representative Liebling and members, I'm going to encourage members to vote no on Representative Liebling's motion to suspend the rules. And I'll just bring up one other thing. Whether we're going to continue to work on this, and whether it's ultimately the governor's idea where we send the money through the insurance companies, or a different idea where we send it through revenue or something like that, whatever the end result is, one thing that we haven't talked about at all that nobody's brought up is having this go through MNsure. If MNsure was doing what it should be doing, they should have all this data, and they should know right now and be able to do it almost right away, be able to send this money back to the people that are getting tax credits or the people that got their insurance through the MNsure program. And I think we should all think about why we're not talking about MNsure and why they're not involved, no matter whose proposal it is. I don't think anyone treats that as a serious proposal right now. And members, Representative Liebling, I think your heart's in the right place, and I'm sure we'll be talking more about this issue as time comes here. Again, with people from both sides of the aisle, from both bodies, lots of people are going to weigh in on this. But members, I would encourage a red vote on the motion to suspend the rules. Thank you.
The member from Candy, Ojai, Representative Miller.
Thank you, Mr. Speaker. Members, I would also recommend a no vote. Representative Liebling, you said, let's get this done quick and dirty. What happened to swift and competent just a few minutes ago? I want to tell you, members, about a constituent of mine named Dave. About a month and a half ago, he had pretty serious throat cancer. It was supposed to be about a half-an-hour procedure. It turned almost 12 hours long. They took out about 60% of his tongue and most of his throat. They had to cut muscles out of his stomach in order to rehabilitate that part of his life. He started chemotherapy, I believe, in about November, and it's expected to go through March. Representative Liebling, we tried to offer an opportunity for us to be able to help this constituent of mine through continuance of care. Right now, what he is facing, regardless of how much you reduce payments or not, he is facing, they finally found someone to give him his chemotherapy about 150 miles away, which he's going to have to pay a lot more for as it is. After that, for the work that he has to do between the, I believe it was 45 staples they put in his stomach and the muscle that they had to put up there, he has to go about 100 miles in another direction in order to get that attended to. This doesn't even address chemotherapy. This doesn't address the medications. I don't know about him, but many of the people in my district are no longer going to be able to go to their pharmacy. Some of them have to drive 70 miles to their pharmacy and pay a great deal more money. So Representative Liebling, I appreciate that you talk, and I appreciate these members talk about let's get this money out to the people that need it, okay? I question the effectiveness of that in my district, but let's bring that out. That was my compromise to the governor, saying, I'm willing to spend that money that I'm not so sure is really going to be used appropriately, but I'm willing to consider that if Dave can get the care that he needs. So if you vote for this suspension of the rules, you are voting against Dave.
Representative Hortman.
Thank you, Mr. Speaker and members. Well, it's too bad that the Republicans don't want to move today on House File 67. This is the provision that was put in front of the 5 leaders on December 2nd. This is the provision that everyone said that we should do without delay. Everyone who was in that room that day said there's absolutely no reason that we shouldn't do this in the month of December, and we certainly could have had a special session in December. We didn't need to come to final agreement on the tax bill and the bonding bill. Those were the conditions set out by the Speaker and the new Senate Majority Leader. We certainly could have done premium relief in December. And it's a big deal for these families, because for some families who are getting an $1,800 a month premium increase, this bill would provide $600 in relief. So for a family to know that that $600 is coming while we do our work here on reform and try to make things better for the whole system is a big deal for a family that has to make car payments, college payments, and buy groceries, to have that certainty that the money is coming. There's no excuse for us to not have done this in the month of December. There's no excuse for us to not do this today. The big difference between House File 67 and House File 1 is this is ready for prime time. It's clear, it's known, it's quantifiable. We have all had the language for a full month. The health insurance plans have said it's workable. The administration has said that it's workable. So we know that this bill, if we were to take it up and pass it today, would provide families with meaningful relief right now. It's regrettable that the House Republicans are not willing to move forward to give Minnesota families premium relief now.
The member from Washington, Representative Dean.
Thank you, Mr. Speaker. Would Representative Pryor yield for a question?
She will yield. Representative Dean.
Thank you, Mr. Speaker. Representative Pryor. It looks to me that there's about $311 million that we're going to be spending that you wish to vote for in this bill. Could you tell me where that money comes from and where the money is going, Representative?
The member from Hennepin, Representative Pryor.
It's coming from the state's reserves. Nope. Not. Correction. I'm a freshman. I was not here in December, and would if this were a special session, it would have been Yvonne Seltzer that would have taken up this bill.
Representative Dean.
Thank you, Mr. Speaker and Representative Pryor. Actually, if you go to line 2.20 of the bill under Section 3 funding, $311,645,000 in fiscal year 2017 is appropriated from the Healthcare Access Fund. So that's kind of a big deal that we're taking money out of the Healthcare Access Fund if we move forward with the provision that Representative Liebling suggests, draining the Healthcare Access Fund, which will take that money away from the Minnesotans who absolutely need that the most in order to keep up with their low-income Minnesotans for their health care. The bill that Representative Hoppe brought forward does not do that. I think that's a pretty clear distinction, and Representative Liebling, I think that you would have done well to at least let your members know where that money is coming from. And where the money is going to, Representative Pryor, could you tell me, do you know where the money is going to go to?
She will yield. Representative Pryor.
My understanding is the money will go directly to people that need premium relief. And I can add, too, that when I was in the campaign, I door knocked and I talked to constituents. And I stood at the door and I had somebody tell me, shaking, white, in the face, about how their premiums were going to be increased, and they didn't know how they were going to pay for it. And so I know that this is an emergency, but that it should be done deliberately and thoughtfully. And I think the bill that was agreed to by the governor, that was agreed to by the speaker, that was agreed to by the Senate, I think that's the bill that did have the time to be vetted, and it's a bill that we're asking to be considered today. I was not here in December, and so obviously I'm not as familiar with the bill as some are, but my understanding is this money would go to the people that need it.
Representative Dean.
Thank you, Mr. Speaker. Representative Pryor, on page 2, if you just flip up the bill, you were on, when I asked you before the question about where the money comes from, that was 2.20. And on the left, the first number is the page number, and then there's a dot, and then there's another number, that's the line. So if you just go up to 2.10, that means the second page of the bill and the 10th line of that page. It's payments to health carriers on behalf of eligible individuals. So what that says is that under your proposal, this money would go directly to the insurance companies. And so I'm not sure if that's what you heard from your constituents when you were door knocking, and maybe it is, but you should at least know that that's where the money is going to go if you vote in favor of Representative Liebling's proposal. So that's where the money comes from, and that's where the money goes. So we pay pretty close attention to that in our committee and in most finance committees. So that's how that works under Representative Liebling's proposal. So I don't mean to pick on you, Representative Pryor, but I'm just highlighting. I'm highlighting that you're now in the legislature and you're voting. So when you bring up a proposal, Representative Liebling, it's good to be fair to your freshman members in particular what you're proposing, because this means stuff. And I can tell you that on October 1st of 2016, Minnesota was shocked and surprised to find out that the individual market didn't get eroded, didn't fall apart a little bit, it collapsed. And the agreement that was signed between the insurance companies and Governor Dayton never should have been agreed to. And it was agreed to weeks before the election with no time to react. And now middle-class Minnesota is in a vice because they have no access to their doctor, no access to their clinic, no access to their hospital. The doctor they said they could keep if they wanted to, they don't have anymore. In fact, that one got canceled last year. You have to drive by your old doctor in your old hospital to get to your new hospital and your new clinic in a different town. If you're lucky enough to get health insurance for $2,000 a month, $3,000 a month or more. This is a crisis, it's not a laughing matter, and it's not just 5% of the state. It's a big deal. So Representative Liebling, if you're asking to suspend the rules to address this, I think we are going to be chewing on this plenty in the opening days and weeks of this session, but I think that we want to be, if you say that the proposal that Representative Hoppe was not ready for prime time, obviously you're not ready.
The member from Olmsted, Representative Liebling.
Well, thank you, members. It's really good to be back. It's really fun to have these debates. Thank you, Representative Dean. You know, picking on the freshmen, that's an old trick, and I kind of thought about doing that for your freshmen on this extremely complicated bill that Representative Hoppe wanted to suspend the rules for, and I decided it wouldn't be fair. You know, I mean, I just want to respond to a couple of things that were said here. One is that the reason that the money in this bill comes out of the Healthcare Access Fund is because the Speaker insisted on that in this process. This was an attempt to let the Speaker have what he wanted to. I don't like taking it out of the Healthcare Access Fund. The governor had a different proposal to take it out of the budget surplus, and the Speaker wanted it to come out of the Healthcare Access Fund. So that's why that's in there, Representative Dean. As far as the money going to insurance companies, that's really not true. This would be, under this bill, people would get their bill and they would get a deduction of the 25%. And then the money going to insurance companies would be reimbursing them for giving the deduction off of the bill. So, you know, I guess if you want to be, you can say it goes to insurance companies. I guess in a technical sense it does, but it's a direct deduction off of people's bill for their insurance. So in a very real sense, it's money that won't come out of the pockets of your constituents who are really struggling to pay for these bills. So a couple of other things. I mean, we've had quite a debate here, and I know it's not going to be the last time we go back through these issues, but this is not about MNsure. We've had a lot of discussions about MNsure. I'm sure we will again. We all know that MNsure's constantly improving. You know, I know the Republicans love to talk about what a disaster MNsure is. It just isn't true. And thousands of people in Minnesota who've bought their insurance through MNsure and gotten their subsidies through MNsure just know that it isn't true. So Representative Zerwas, you know, when your rhetoric doesn't match reality, it becomes a problem. I know this is the mythology that people like to repeat and repeat, and it was bad in the beginning. Everyone acknowledged that, but it has gotten a whole lot better, and it has helped many thousands of Minnesotans buy their insurance or get onto public programs. So this is really, Representative Hoppe, this really isn't about MNsure. I'm a little confused by your comment about how we could use MNsure. This is about people, many of whom are not buying insurance through MNsure. This is about the individual insurance market. People are buying insurance either through MNsure or not through MNsure. MNsure does not set insurance rates. I don't know how many times I have to keep repeating that, but MNsure does not set insurance rates. This has nothing to do with MNsure, except that MNsure is a place people can go where if they qualify, they will get immediate help to buy down their premium, if they qualify. But this bill is about people who don't qualify, who still are struggling to pay. And that's why this bill was necessary, because not everybody qualifies for those subsidies to help them buy down their premium. So Representative Miller, you know, if we're going to take the position that if a bill doesn't do everything, we shouldn't pass it, boy, we're not going to get very much done again in these 2 years. You know, this bill is not the be-all and end-all of fixing our health insurance system. Everybody acknowledges that. This is just one first step to get people through this first year. I acknowledge there is a problem. We all know there are other problems in the market. There are problems with accessibility, just like you indicated. But are we really going to hold ourselves back from helping some people who really need the help because we can't fix every problem right out of the box? And my worry, and the reason I think that most of us voted against suspending the rules on the other bill, is that we're worried that if you rush headlong into some of these changes, you might hurt your constituent instead of helping him. We want to make sure the changes we make actually help. That's all of our goal. And so look at Congress. They're like ready to pull the rug out, or maybe they've already done it today. I don't know. They want to pull away insurance because they hate the ACA, Obamacare, you know, that's the devil for everybody now, and they want to pull the rug out from under that, and they don't even know what they want to do instead. And let's not be like Congress, shall we? I mean, we can do better than that. We've done better than that in the past. We can actually work together. We can actually vet our proposals, and hopefully we can get something done. Would Representative Dean yield to a question?
He will yield. Representative Liebling.
Thank you, Mr. Speaker. Representative Dean, I just want to know, would it be your intention to give a hearing to the governor's bill in your committee?
Representative Dean.
By the governor's bill, I'm assuming, Representative Liebling, that you mean the bill that we saw as introduced as House File 67, and I'm sure we will probably see many bills like that that aim to provide premium relief. The governor has proposed one way, and there's been other ways that have been proposed. Some of them would need to go to the Health and Human Services Finance Committee. Others wouldn't, depending on where the funds come from. So we'd have to look at that. This would include the Healthcare Access Fund. So if this were introduced and were passed out of a policy committee, it would have to come before the Health and Human Services Finance Committee because it includes funds from the Healthcare Access Fund.
Representative Liebling.
Well, thank you, Mr. Speaker. And boy, that's a pretty inconclusive answer, I would say. Well, Representative Dean and the other chairs on that side, I sure hope that you're willing to at least hear these bills. You know, this is about our constituents, the people that you say that you care about, and I think you do. You know, the farmers, the small business people, they're the ones that are hurting. They're the ones that need this money, and they need it soon. And there's no reason that you couldn't pick up this bill, House File 67, give it a hearing. This could go through next week. And this could go through really fast. And I know it doesn't do everything that all of us might want. There are other problems. But members, you can't let the good be the enemy of the best be the enemy of the good. You know, we just can't do that. Otherwise, we just get nothing done. So this is really, really disappointing to hear. But I can tell, I can count votes, and I know that there isn't going to be any, this is going to fail, this motion's going to fail, and, you know, there's kind of no point in that. But we're going to be revisiting this quite a bit. You know, Representative Hoppe, just finally, I wanted to respond to something that you had said. You know, it's great. I love working with you. I have no problem sitting down with you. We can try to work through these things and all that. But the issue isn't whether you and I can do it. The issue is whether Minnesotans can do it. You know, that's the thing that we all need to be cognizant of. And, you know, I do think it would be better to have this bill go through committees. I really hope that that happens because, you know, there may be tweaks to this that need to be done, but I just hope that we don't end up sitting on our hands on this relief people need now because it isn't perfect, because it doesn't have everything in it. This is a bill that we know this relief can be given to people now. And I hope that Representative Dean will see his way to hear this bill soon. And I think it's Representative Schumacher's now the chair of the policy committee, and I hope that he'll hear the bill and that it can make a quick passage through so that you can all deliver what I think you promised your constituents, which is some immediate help to get this thing done. So, Mr. Speaker, with that, I'm going to withdraw the motion.
Representative Liebling withdraws the motion.